We see the images every night. American troops killed and injured in Iraq by the thousands. Those who are returning home with serious injuries don't get to leave the war behind when they come home.
Time News Channel 3's Cheryl Khan joins us with more on the war after the war and a Coachella Valley woman who's trying to help. Cheryl.
Well, it's something we'll probably be hearing a lot about in the coming years. When those who've served in Iraq come back wounded, in a sense, they bring the war home with them. And now a local woman is trying to help them get back to normal. Three-year-old Sebastian McQuigg likes to play with his dad and his trains.
Hi, everyone.
Yeah.
Okay, thank you.
You're welcome.
But there was a time not too long ago when his father wasn't able to do this because Sebastian's dad, Staff Sergeant Paul McQuigg, was seriously injured in Iraq when a roadside bomb went off.
Someone was watching us and a bomb blew up on my side of the vehicle.
Paul regained consciousness several days later in a military hospital in Germany. When he saw his face in the mirror, he was shocked.
My whole head was the size of like a baseball. I was so swollen. I had no hair.
More than a dozen surgeries later, Paul was still left with scars on his head and abdomen.
I had an open wound. You see a scar here right in the middle.
As well as on the side of his face, inside his mouth, and on his tongue. He's unable to eat and has to be fed through a tube in his stomach.
Shrapnel went through one side of his jaw to the other side of his jaw.
Paul's mother, a registered nurse, moved from the Midwest to San Diego to help care for him and for Sebastian, whose own mother is no longer in the picture.
Did Daddy get an owie on his face?
Yep.
And on his tongue?
Mm-hmm.
Does Daddy have a hard time eating?
Yeah.
Jacqueline McQuigg says it hurts to see her 30-year-old son in such pain. Not all his injuries are visible. Paul has severe headaches and memory problems. But the worst part, Jacqueline says, is the way some people have treated her son since he came back from Iraq.
He's very intelligent, but a lot of people, because he has the speech impediment, he's not always treated appropriately when he approaches people in the public, when he's tried to talk on the phone, because he wants to be very independent and take care of his own. Several people hang up on us on the phone because of his speech.
Paul says that treatment sometimes makes him angry, but he's learned to live with it. Like other vets who've returned home with similar wounds, Paul would like to get back to normal, to the way he used to live and look. The military says there's not much more they can do for him. And that's where this woman, Rancho Mirage resident Maggie Lockridge, comes in. Maggie's a Vietnam-era Air Force veteran and retired nurse who once had a thriving consulting business providing luxury aftercare for wealthy cosmetic surgery patients.
We had the movie stars, we had the news commentators, we had, you name it, we had it. The people in politics and duchess and princesses.
Lockridge says she was watching a TV special about ABC anchorman Bob Woodruff, who'd been critically injured in Iraq, when she had an epiphany. She says she realized wounded veterans needed much more help than they were getting from the VA.
It's the shrapnel scars and the burns that need new grafting, and just the disfigurations from the artillery wounds that they have that aren't always permanently addressed.
So Lockridge started a nonprofit to raise money to provide cosmetic surgery for injured Iraq vets. She called it IraqStar, a play on the phrase rock star, because she wanted to treat the vets like celebrities, using her connections to get them the kind of help usually reserved for Hollywood's A-list.
Paul, I'm going to ask you to tell me a little bit about your history.
Beverly Hills cosmetic surgeon Dr. Norman Leaf treats so many celebrity patients, his office has secret entrances so stars can slip in past the paparazzi. Dr. Leaf says he's not in favor of the war in Iraq, but does support the troops who've served there and wants to do what he can to help.
They come back and, you know, they need to get jobs. They want a date.
But even with the help of doctors like him who volunteer their time, IraqStar needs lots of donations to help Paul and other wounded vets. Still, this is a great first step for IraqStar and for Paul.
Paul realizes he's getting movie star treatment here in Beverly Hills, but he says that's not what's important. What really matters is just knowing there are so many people who care.
It's humbling. No, it's very humbling.
Paul has a long road ahead of him with many more surgeries, but he says he feels lucky to have come back alive and to have so many people who want to help him.
A lot of people watching probably want to help out. How can they do that?
Well, IraqStar does need donations, so you can go ahead and do that. You can find out more by logging on to IraqStar.org or KESQ.com.
Great organization. Thank you very much, Cheryl.
Thank you, Cheryl.